This final chapter in the health promotion course covers what we can expect as far as the overall trends in health promotion going forward in the future. Some of this is based on the materials provided in your text. Some of this is going to be some material that I'm going to bring in that you want to be aware of. So first of all, not a surprise. What we need to be aware of going forward is that the baby boom population will continue to be very influential in terms of the overall approach, and when it comes to promoting health, is going to be the group that a lot of the focus is going to need to be on in order to be able to contain costs when it comes to health insurance. So as of 2013, the baby boom population made up about 43 million Americans. By 2016, this was 49.2 million Americans. By 2030, we could expect that this will be around 73 million Americans. And so a lot of us probably stereotypically think of Florida as a retirement state, an older state. By 2030, our entire country will look like the current state of Florida in terms of the percentage of people that are that 65 plus population. On average, about 10,000 people in the United States retire every single day. That number has doubled since the year 2000. And so that is becoming quite an issue when so many people are leaving the workforce and there's not enough people to fill in those jobs, especially in the healthcare industry. The fastest growing age group in this country is the 85 and older group. Again, that's mostly a dependent group that requires Medicare, Social Security, sometimes also Medicaid, and requires some of the facilities and things that we've talked about, not only in this class, but also talk about in the health professions class. That means healthcare facilities, even barring what we're currently experiencing, they're overcrowded, they're understaffed, they're underfunded, and so you have a significant need for healthcare to match the current age group, which it currently doesn't. And so there's an economic struggle, and we're going to talk about this a little bit more here in a little bit. But the economic struggle has a lot to do with the fact that these individuals are on social programs that are funded by taxes, including Social Security, Medicare, and there's not enough young people to come in and fill in that gap and pay for those programs. And so some changes are likely going to need to come in order for that to continue to be affordable. You can learn more about that in the YouTube video that I've included. So go ahead and check that out in terms of learning a little bit more about the economics of this situation. Um, on the flip side of this, we're also dealing with health problems in the younger population. We hear quite a bit about childhood obesity. In 2014, that was 17% of American kids. That's grown to about 18.5% as of 2019. So that continues to tick up. Um, of those uh, born in 2000, about a third will eventually develop type 2 diabetes. And again, this is something I've included a YouTube video where you can learn a little bit more about what's happening in terms of childhood obesity and some of the potential solutions to that. Yeah, this is certainly a problem when you have so many older Americans having health problems, and then you're seeing chronic disease develop in younger children. So type 2 diabetes, very much being a chronic disease, was considered adult onset diabetes, and is now, we can't call it that anymore. We have to call it type 2 diabetes because kids can get it now. And so this is a real problem when this is a generation of people that we're going to need to be the leaders here in the next decade, as far as organizations and the workforce and politics and other things, and they're dealing with health problems at far too young of an age. Um, a lot of these kids involved in organized sports, many of those sports are year round. We talked about that in sports psychology as far as specialization and potential issues with that. At the same time, you have a lot of kids that are not being generally physically active and going outside and running around and climbing trees and doing things like that. And they're not getting as much physical education in schools. And so when we combine the first and second slide, we have an unhealthy younger population going into the workforce that's going to have a higher burden on their health insurance, and you have an increasing percentage of older adults that are dependent on tax funded programs, ones in which the younger population has to fund. and it's not a good combination. We were heading for a disaster even before some of the things we're experiencing right now, and so potentially the coronavirus issues we're dealing with it might push this even further in terms of an economic crisis. Um, and that leads into this third trend, which is the economic burdens of healthcare. We talked about this a little bit already, but the amount of money we were spending on healthcare, even in just the last few decades, since in 1980, we were spending about a quarter of a trillion. By 1990, three quarters of a trillion, and then 2016, 3.2 trillion. By 2017, 3.5 trillion. Again, the numbers aren't as critically important as the incredible growth. And again, some of this has to do with the baby boom population. Some of it just has to do with the overall inefficiencies of the system. This is a little bit more of a health policy and law conversation. Many of you taking that course understand this a bit better than those that have not taken it yet. But this is certainly problematic, certainly something that's going to have to change. And, it does become a little bit of a political issue, and a lot more people are pushing for potentially like a Medicare for all universal solution to this. Others are pushing other potential solutions in terms of expanding the Affordable Care Act or going with a completely different healthcare system. But at this point, we're talking about 18% of our gross domestic product in the United States. So every dollar spent in the United States, $18 or 18 cents of that dollar is spent on healthcare. We compare that up to other countries, that's double, right? And we spend four times what we spend on defense on healthcare. We spend about $10,000 per person, which is not efficient whatsoever. And what also makes this inefficient is that about three quarters of this is all stuff that's preventable. So our leading killers are heart disease, cancer, diabetes, COPD, other things like that. That is preventable stuff. And if we focus a bit more on prevention, there is a really good chance that a lot of these numbers will start to correct themselves. You can learn more about that information on the YouTube video that I've included there as well. Okay. One of the trends we really hope will happen, I don't know that we have much of a choice, but a lot of what we're going to have to do is get people focused on prevention and self-care. We're going to have to start trying to prevent these diseases. People are going to have to get better at taking care of themselves. And really, the reason for that, in many cases, is in order to be sustainable economically, people are going to have to remain healthy, to remain employed, to keep their health insurance, and to be able to afford to, have a quality of life that's high enough. Some of the solution to this may be increasing the minimum age of Medicare eligibility. Numbers have been thrown around to 68 or even 70, depending on the political climate in the country. Others, again, have suggested shifting this all the way down to where everybody's eligible for Medicare. And again, this is a little bit more of a health policy conversation, but one that is worth considering. Younger populations are going to have to get into a situation where they're going to take care of themselves. We do see younger populations seeking out cheaper options other than the standard medical care. So complementary and alternative medicine has seen a huge increase. So things like chiropractic, supplements, other things like that have grown in popularity because people are looking for cheaper solutions to better care for themselves outside of the standard healthcare system. All right, a little bit more about this. As the cost of care increases, people really have no choice but to take care of themselves to avoid some of these visits. In 2016, average emergency room cost visit almost $2,000. Now, granted, health insurance will take care of some of that, but not all of it. And that percentage increased almost one third in only 4 years. And so the cost is getting shifted to the consumer. We learn about this in health policy and law, that there's the more that healthcare becomes expensive, the more we as the consumers will pay. Um, what's also shocking about this is a third of the visits were completely unnecessary to the emergency room. Unfortunately, a lot of those people don't have health insurance and are going to the emergency room as their source of primary care. In 2013, The average physician visit cost was $228, so a lot less than going to the emergency room, so that's a good thing. But even a third of those visits were completely unnecessary. So getting people into situations where they're better able to recognize whether they need to go to their doctor, whether they need to go to the emergency room to try and bring costs under control. We also have a major issue with prescription drug use in terms of the overprescription of drugs and whether or not that's necessary. Again, in other classes, we talk about Medicare and specifically Medicare Part D and how that's the prescription drug benefit. And such a large percentage of the older population is on a prescription med. Half the overall population takes at least one prescription drug daily. Um, Almost a quarter take 3 or more, and you have over 10% or 11.9% taking 5 or more prescription drugs. Again, um, I think we'd agree this is probably too many for most, and this is one way to potentially bring costs under control. One of the other things we've mentioned in some other classes is the rural to urban shift. The percentage of people living in rural areas is decreasing as a percentage of the population, and the percentage of individuals living in urban areas is increasing. Rural areas, as you see on the slide, 97% of geographic area, but only 19% of the people, and that will go down. So the rural population overall in the country decreases on average by about 43,000 people per year. You have over 1,300 non-metro communities losing population or net losses in population since 2010. Population decreases have been significant since 2006. So we've been dealing with this for about 15 years. And you can learn more about this on the website that I've included here. As of 2014, about a little over half of the global population live in cities. By 2050, it's going to be 2/3. So you're just going to have more of this shift, and that's going to change healthcare and health promotion as well. And one of the things we've talked about in this class a little, we talk about it more in other classes, is the shortages that this is going to cause. We have about 20% of the population currently in rural areas. Sorry about that. But only about 10% of the physicians live there. And so you don't have as many physicians per person. Um, More than 3/4 of rural counties are considered health professional shortage areas. You don't have enough nurses, you don't have enough doctors, and so the ratios are thrown off. In a rural area, you don't have you'd have about 40 physicians per 100,000. In urban areas, you have well over 50 physicians per 100,000, and that may not seem like a huge difference, but that could mean the difference between getting in that week and getting in the next month in terms of wait time. Same thing with dentists. In rural areas, fewer dentists per 100,000 than in urban areas. Again, wait times are longer. People push off seeking care, and the quality of the overall care tends to go down. Um, the demand for healthcare will continue to go up, and this is specifically the entire conversation in the health professions class, which some of you have taken, or some of you are in, or some of you will take. Healthcare um, provided in 2013 about 16 million new jobs, or 60 million total jobs. 2018 alone, 346,000 jobs were added, and they were just healthcare jobs. And we're going to see this continue to go up, much more so than other types of jobs. And so there's a need. So those of you, most of you going into a healthcare related position, you will definitely have some job security. A lot of the demand is focused on the 65 or older age group, which we just saw in the first slide. Is going to significantly increase. We also have the Affordable Care Act adding more people to the health insurance pool, and so those people are seeking out care that they didn't have access to before. But we're already in a spot where we have a healthcare professional shortage. We need more primary care providers. That's why we're seeing such an uptick in nurse practitioners and physicians assistants. You see the last bullet point there, 13 of the 20 fastest growing occupations are healthcare related, and that's the 20 fastest growing occupations overall in the US. So 13 to 20 are in healthcare. You can see some examples of who these individuals are. on this slide. And a lot of it is working with older adults, doing things that are involved in treatment. Some of it is prevention related, but gives you a sense of where this growth is happening. Okay, so that's the end of chapter 12. It's also the end of the content for um, the course. So if you have any questions, make sure you refer to your book, refer to the PowerPoints. You will have an exam coming up. Um, that will be due on April 22nd. And I will be providing a little bit more detail on that. It will be the same format as the first two exams that you took. Okay. If you have any questions, let me know. Thanks.